From midnight tomorrow, people living in metropolitan Melbourne will see a slight ease in restrictions as they reach their 70% first dose target. Here's what Premier Daniel Andrews had to say at this morning's press conference.
This is what Victorians have craved for a long time. It needs to be done safely. It needs to be done carefully. We're not overselling it. They are modest changes, but they are significant. There's a degree of good faith in this. I'm asking people to do the right thing. If people do the right thing, then we'll be out of lockdown sooner.
Regional Victoria, excluding Ballarat, who last night entered a week-long lockdown, will also see a further easing of restrictions as gyms and pools are able to reopen with density limits in place. Meanwhile, in New South Wales, hundreds of healthcare workers face being stood down if they don't get their first COVID-19 vaccine before the September 30 deadline. For more on this, I'm joined by Melbourne GP and former president of the Australian Medical Association, the AMA, Dr Mukesh Haikerwal, and what a lovely man he is. Welcome.
Good evening. How are you?
Good. We heard Premier Daniel Andrews there making his announcement that there will now be a sixth reason to leave home. As a GP, what do you make of the decision to allow people to meet up socially in parks?
Look, I think you can understand why this is an important step to take. I think that people are really quite sick of this whole process now. I know that people don't want any more lockdown. And I think they want to try and get back to some sort of normality. And we're seeing many people attending for vaccinations, which I think is really key and core to the whole coming out of this. I think the thing to be cautious of is not having the rebound, open up, close down, open up, close down, as we've had. We had the seventh lockdown and we went into fifth lockdown, went to sixth very quickly because we potentially came out of it too soon. And I think people would probably prefer to be sure that we're taking a step and it's not going to go backwards and we can do this for good reasons and that we can actually then build on it and not go backwards again. So, we know that people need to get out. We see them exercising. What often happens, and I think that the key words in that last clip you had was do the right thing. And, unfortunately, our system absolutely depends on people doing the right thing, going by the rules, making sure they've got their own backs and other people's backs. But unfortunately, that's not always the case. And certainly in health, we often see people will come in and not be honest about their symptoms, will come in when they haven't had been tested. And so you're putting everybody at risk, not wearing the masks properly. And it really does depend on all those things happening. So there's not any one thing, but a whole cluster of things we've got to get right to make sure we do this safely.
Well, we know there's going to be different rules based on, whether you're vaccinated or not. For instance, even if you've got one vaccination dose, there's the limit for two people for those who are unvaccinated or have one dose is different. But the Premier did say, you can't police that. You can't have police. It's just so not going to happen. Police going, show me your, is this just your first dose today? That's not going to happen. So it's all ultimately about trust, right?
Absolutely. And, I think that the method to learning, the best way of thinking about this is let's have something called universal precautions. Let's assume everybody in front of you's got COVID and assume you got COVID. So what would you not want to do if you had COVID in the way in which you do your movements, in the way you're in front of people in front of you, your friends, your colleagues, your relatives? Just make sure you are still adhering to what we still have to do, which is the distancing. And it's okay for somebody to say, can you please back off a bit? Put your mask up, don't put it, make sure it's over your nose because that's where the problems are. It's actually okay to say that. It's a bit of an etiquette. We've had sneezing etiquette. We've had now distancing etiquette. And it's important to make sure that we do that, even smoking etiquette, do that to make sure you're keeping yourself safe, but people around you safe. The mask is so important still. And, I think that everyone's looking forward to the day that we don't have to have them. And that's great when it happens. But in the meantime, until we get there, we just got to do the right thing.
Dan Andrews is also set to announce Victoria's roadmap out of lockdown on Sunday. This announcement comes on the same day as Dr Roderick McRae, the president of the Victorian branch of the AMA, advised against easing current restrictions until 2 weeks after 80% of the eligible population are double vaccinated. Do you think that should be the trigger point?
I think Roderick's coming from a point of view of the health professions, the medical profession. And, we are very much in the front line of this. General practices are being shut down literally at one day's notice because somebody stepped on another landmine and the patients come in and gone home and then you get a phone call from the mother saying, my son's come to see you this morning. I'm actually positive. And that means the doctor's now having to shut down for 14 days. That's a real story, by the way. It's somebody I talked to today in Broadmeadows. It's a real story. It happens. And so that's why it's important to make sure we've got proper infection control and support in the practices. And then in the hospitals, there's a very limited amount of capacity we have. And people are being furloughed. As a GP, I sit sweating in my room thinking, is somebody going to need to go to hospital? And if they do, which hospital can I send them to? Because one after the other, they've been closed. Ambulances don't have people to drive them. If they do get somewhere, they may be ramped. And even the key COVID hospitals having to furlough hundreds of people. So it means that to get services are very limited. And the whole way we plan this has to be much better. And we've got to make sure there's a clear pathway for someone with an illness to be looked after, whatever it is, and not necessarily in the place they would have taken as their first choice. So, in general practice, we might say, can you go and get a swab test before you come? Or if you've got a respiratory clinic, have your test and we can examine you with full PPE and do this in a safe way. And we've got to think about how we do that now. But actually, we've got to put into place right here and now what we do in the future. So it's not just about opening up and going for a picnic. It's actually how do we make sure the people in front of us are safe? How do we make sure we're doing the right things to keep them safe and ourselves safe? And how do we look after ourselves should we get into trouble?
I just want to talk about New South Wales before I let you go. Hundreds of healthcare workers in New South Wales face the prospect of being stood down if they don't get their first COVID-19 vaccine by 30th of September. That's a deadline. If healthcare systems are already under strain, is there a risk that we lose valuable workers this way?
I think it's a bit of a playing chicken, that particular game. I think that, every day, every week, I will see people going into healthcare sciences as a student or going on placement or changing jobs, and they all have to have a set of tests and surety that they have been immunised against certain things. So in many ways, what we're looking at with flu vaccine has been, well, you can't do this without a flu vaccine. And this is very much the same thing. And so we need to give people the right information, the right knowledge, and give them the ability to make the right choice, and also give them the access to get a vaccine. In healthcare, that's been much more simple than for other people. But actually, the access has not been that good. Before we start laying down the rule, we've got to make sure there is access. But yes, we do need to get vaccinated. It's important for that to happen. And it's much better for that to be with consent and with some better understanding. Because, if you did have people saying, well, okay, I'm going to walk, it would be really problematic. And it's much better to say, we need you to be doing this. Every health professional knows that the best way to look after their patients is to look after themselves. If you don't get a flu vaccine, you might get flu, you might give your patient flu. Well, you know what? It's the same for this. If you don't get the COVID vaccine, you've got much more higher chance of getting COVID yourself and not being able to look after your patients and people around you. So I think it's much more about the rhetoric, getting it right, not the big stick, but very much the kind, thoughtful, supportive mechanism to make this happen, because ultimately these people are doing their work and are putting themselves at risk every moment of every working day, and they need to be supported in this and to make the right decision and not being whacked when they are still trying to do the right thing. And often they've been misled or they've been misinformed or they're just completely confused, which is not surprising the way this has been rolled out.
Thank you for joining us.
Thank you.
Dr. Mukesh Haikerwal, Melbourne GP and former president of the AMA.